Ready? Hello, my name is Leo Perez, and today I'm going to be covering one of the topics of psychological disorders. And the disorder that I have chosen is bipolar disorder. And I will be covering such things as the physical symptoms, associated behaviors, diagnosis and detection, nature versus nurture, and also the treatment of bipolar disorder. To begin, I would like to say that bipolar is a neurobiological brain disorder that affects about 1% of Americans today. That would be 2.3 million people have bipolar disorder. That is a lot of people, and we probably work with some of these people that suffer from bipolar every day around us in our daily jobs. Wherever we find people, there's people with this disease or disorder. Some of the physical symptoms or symptoms that we will see in behaviors with people with bipolar disorder is mania, which is having little sleep but excessive amount of energy. Mania is also having racing thoughts, doing reckless things without concern of the consequences, maybe overspending money, um, excessive spending, we could say, and also such things as being overly sexually active is one of the manias that they can have, making foolish business investments. And that is one of the symptoms of bipolar. Another symptom that they can have is depression, which is the opposite of mania. So in bipolar disorder, they have from one extreme to the other. You'll have one day they can have mania, and then the other day they can be totally depressed. And when they have depression, they may sleep a lot. They may have a lot of negative thoughts, negative conversation, um, decreased appetite, and changes, like I said, in their sleep habits. Uh, when they diagnose bipolar disorder, it's usually looking at these symptoms that I just spoke about, which is mania and depression. Um, there's this is what the doctors will look at. This is what the counselor may look at, and the way they discover this is by asking the patient questions or asking maybe the mother, the father, family members on what kind of things this patient is doing, what kind of behaviors they're having. And the role of nurture versus nature, or excuse me, nature and nurture, there's not a whole lot of biological discovery as far as, say, a CT scan, an MRI, blood work that can tell them that they have bipolar disorder. There may be some physical, maybe a smaller brain, larger brain, physical things that they can have when they have bipolar, but that is not something that doctors really look at. They really go by the symptoms and the behaviors that they are being informed about. The overview treatment, some of the treatments they do get for people with bipolar um, is medications that they have. Two medications that they can get is mood stabilizers and then antidepressants. Mood stabilizers are such as include lithium and valproate and carbamazepine. The antidepressants could be bupropion, which is Wellbutrin, and then inhibitors such as Prozac. So these things counteract. If they're having mania, they'll give them a mood stabilizer. If they're having depression, they'll give them an antidepressant. So sometimes they're taking both of these things for the symptoms they're having. I want to also conclude my video here with talking about the field of psychology and describing my view on it. I want to say that psychology is a very interesting topic. I am actually also a minister, a Christian minister, and psychology has always been something that interests me very much, being that we deal with people all the time, talk to people all the time, meet different people, and we do run into people with certain behaviors that are symptoms or signs of bipolar. And as I've studied and read into these disorders, I found that back in much years back, psychologists or people thought that everything was something spiritual. And psychology helps us understand a lot of these disorders, that they're not all about spirituality, but also physical, also emotional type things going on in the brain that could be causing disorder in a person's life. So I think psychology is very important to learn, and everybody should have a certain amount of knowledge in psychology to understand people. Being that we're healthcare workers, we need to really understand people who have psychological disorders or mental disorders, so that we can learn how to work with them and how to understand them and not make anyone feel different or feel bad, but just work with them and understand. Taking this course has affected my understanding of psychology. I've been able to learn a lot more about a whole lot of different disorders, such as bipolar, such as depression, such as schizophrenia. Some of these I've actually had personal experiences, encounters with them. I can say that I have a sister that suffers from bipolar. She is bipolar, and I have experienced many of these symptoms as a young man, as a child, seeing the actions that my sister has had, her behavior habits. Up to this day, she takes medication for such symptoms, and so it's very, very good to study the aspect of psychology and the disorders, to understand people. And like I said, this topic really hits home, because my mother and my siblings, we have all experienced what it is for someone to have bipolar in our own family. I think this course will help me in life, especially at work, where I will be dealing with a lot of people that have different disorders, different psychological disorders. I work in a rehab hospital where people suffer a lot from depression, being that they have other things going on, such as being physically unable to do things because of an accident, suffering strokes, different things that have affected their emotions, and these patients have gone into some sort of depression or extreme depression. And so this course will help me a whole lot to understand the patients that I work with today. I want to thank you for your time. Thank you for listening to my video, and have a good night.